now you've got your braces on, the only difference is now going home is brushing your teeth. So basically with brushing your teeth, what we want you to do is with the toothbrush, depending if it's manual or electric, with the manual, what we want you to do is angle it on a 45-degree angle, so you're brushing on top of the brackets and along the gum lines. Do the same thing to the bottom, turn it to a 45-degree angle, brushing underneath the brackets and along the teeth. What you do to the top, you do to the bottom as well. Where the gum lines meet at the top of your braces and the bottom, these are the areas that you need to make sure you brush thoroughly. Reason why, that's where the plaque, that's where the food, bacteria tend to build up the most. If you don't brush this area thoroughly, what you might notice is the gums might become red, might become inflamed, and when you touch it softly, it might bleed. If bleeding presents, don't be alarmed of it, just continue to brush it. The bleeding will eventually stop, your gums will eventually start to heal up as well. With your bristles of your brush, you can't always clean in between where the wires and the brackets sit, so in your little kit that we usually give you, you'll get an interdental brush. It's also called an interproximal brush. It bends, it flex. What we want you to do is just sit it in between the brackets and underneath the wire and clean it in between. This will remove all that plaque build up. These are reusable, so you can rinse underwater. You can buy these at the supermarket, Coles, pharmacy, even a $2 shop. They don't have to be fancy as long as you can use it every day. We do advise this to be used at least once a day, if not twice a day or after every single meal. If you are still at school, you can bring the whole kit that we give you, or you can just have your normal small pixie brush or your toothbrush. You don't have to have toothpaste, just water and brush away just before you go into your next class. Flossing is also important during your braces on. We do understand that flossing can be a bit difficult and it can take a bit longer. So pick a night within the week where you know you can just stick to and do the flossing of that once a week that you choose. So with the floss, what we basically want you to do is thread it underneath the wire. Now you're probably thinking, how am I going to do that? Let me show you. With the super floss, what we want you to do is thread it underneath that wire. See how it goes through? Just pull across the floss, flush your teeth between your teeth, and then thread it back out. You start from one end, you work your way through. Yes, you will be slow at the beginning, eventually become faster at it, you master the routine with it as well. The next thing we want to show you is some wax. Your braces, as you start to get used to it, sometimes give you ulcers with your cheeks and can also cut at the ends when the wires start to align the teeth. So in your little kit, you get a box of wax, just like this one. It basically sometimes comes in a whole roll. What we want you to do is in the area that it's annoying you or the wire's cutting you, roll into a ball. The area, make sure you dry it thoroughly with a nice cloth. Have the wax ready, and once that's dry, place the wax on top. Okay? If the area is still wet with your saliva, this wax actually won't stick, it'll fall straight off. If you are going to eat, brush your teeth, take off the wax. Don't reuse it, always use a new one. And if you accidentally swallow it, it's okay, it'll come out on the toilet, okay? If you ever need some more, don't stress, just let us know. We can send some out in the mail. If you're around the area, you can pick some up as well. The other thing is, as soon as you get the braces on, you're not going to have any discomfort until a few hours. So if you haven't eaten, go and have something to eat. It might be a smoothie, it might be a soft cheeseburger, soft sandwich, or yogurt. After that, do take some pain relief medication. Might be your Panadol, your paracetamol, only because within a few hours, the pain will start to kick in with it. We want you to try and keep on top of it, so try and take it every 8 hours. It might last you a day, it might last you a week. Everyone's a little bit different, so depending on your pain threshold, just go according to that with it. Hard foods you can't bite into are, for instance, your apples, your carrots. Reason why is these brackets at the front can always pop off. The glue we use is not permanent, it is temporary, so we do want to take your braces off after you finish. Doesn't mean you can't eat your apples, your carrots, or the hard foods. It means kind of small pieces, you'll still be able to eat them. Try and avoid your hard, sticky, chewy, lolly foods. Keep everything into moderation. If you need something sweet, it's been a few weeks, it's a few months that you haven't had something, we do advise you probably a milk chocolate block. Suck until it dissolves, then have your water afterwards as well. With the fizzy drinks, same thing with that, keep into moderation. If you are going to have something, make sure you just rinse it out with a glass of water. The reason why we want you to keep everything into moderation with the sugars and to always brush your teeth is the reason because you can always get the white spots which can form around the brackets. Your saliva and teeth have good minerals in it. When you're not brushing those bacteria and the sugars off, they tend to stay within the teeth which draw out the good minerals. You can probably notice that around with this teeth that there are white patches around it. So basically when they are there, it's not something that the orthodontist can fix. It's not something that yourself or your parents can bring you to the dentist and say, can we please put a filling there? It's basically there, permanent for life. Every orthodontist wants nice, straight, healthy teeth. They don't want straight teeth with all the white patches in. You've come through a whole process of getting your braces on, you've had your family and friends for support. Pretty sure you don't want your results looking like this. Please don't be alarmed with the picture that we show you that it's only you that we show. We actually show everyone who actually starts treatment. It's a pre-warning just so that whatever we basically say just to keep everything nice and healthy has a reason for it. We don't say it to make your life harder. It's basically there for a guideline. Time to time a bracket can come off a tooth. If it does, it is important you let us know or even let your parents know so that they can give us a call. The reason why is you don't want to leave a bracket off a tooth for several weeks or till your next appointment. It can always slow down your treatment. Pretty sure you want to finish your treatment on time or even before your actual period of time. Even if something looks odd in your mouth, go to your mum, go to your friends and ask, is this right? It's a quick 5-minute check for the orthodontist or hygienist to check.